Schizophrenia?
Ya, schizophrenia.
Oh, this is the first time to hear this word.
Itu akak tak tahu.
Sakit yang lupa ingatan ke macam ni?
It's a mental disorder.
I just know a little bit about lost their memory.
I think I know nothing. Mental disorder. Going to like clinics or anything.
Running away.
I will call authority person.
Try my best to be friend with that person.
Tak ada, takut dah lari.
I would talk to
Schizophrenia? What do you know about schizophrenia? What comes to your mind when you heard about this term? So, basically, schizophrenia is a psychological disorder which characterized by several symptoms, including extreme strangeness in perception, thinking, action, self-conscious, and manners relating to others. The significant difference between people with schizophrenia and other psychological disorder is due to detachment from reality, which is known as psychosis. In other words, they live in their own world. Have you ever heard of paranoid, disorganized, and catatonic? Well, these are the subtypes of schizophrenia.
Have you ever met these people before? How can we recognize the typical character and physical appearance of people with schizophrenia? So now, let's take a close view on the signs and symptoms of this psychological disorder. There are three dominant symptoms, which are positive, negative, and cognitive. Positive symptoms, which means the presence of abnormal behavior such as hallucinations and delusions. Hallucination occurs when patient experience a sensation that does not exist. For example, seeing, hearing, and feeling. Delusion is a strongly held belief that are not based on reality, false and usually strange belief. For example, abducted by aliens. Second is negative symptoms, which means the absence of normal behavior. For example, unable to pursue the targeted goals. Second, very little speech.
Let's say if we go out watching a movie, go to KLCC, have a meal together.
Yeah, let's go watch Thor Ragnarok.
You want to join us, okay?
Don't want.
You know what?
Why?
I heard that Thor Ragnarok is very good and worth to watch.
I think we should go spend time together.
Yes.
I don't want. I don't know.
Are you sure?
It's okay.
And the last one is unable to express emotion, which is flat affect. And the last symptoms is cognitive dysfunction, which is problems with concentration, learning abilities, and memory.
All of the exact cause of schizophrenia is still unknown. Experts assume it could be a combination of genetics and environmental factors. Well, through genetics, if you have a family history of schizophrenia, you're probably more likely to have it. There has been association during prenatal exposure, such as virus infection, malnutrition, birth and pregnancy complications, and maternal stress as well. Any stressful or traumatic life events such as hardship throughout early life or child abuse also contributed to the development of it. Environmental and cultural factors are not independently caused to schizophrenia. However, immigration and socioeconomic status may increase the risk. Last but not least, substance abuse like marijuana during adolescence or early adulthood may be one of the causes as well.
So, how often schizophrenia occurs in Malaysia? Prevalence for general mental health in Malaysia was increased from 10.7% in 1996 to 29.2% in 2015. 2292 cases were registered in 2003, 2551 in 2004, and 2508 cases in 2005. Most of them were male and unemployed.
Okay, now let's move to the prognosis or the expected outcome of the people with schizophrenia. The study suggests that the earlier people seek help from the expert, the higher the chances of them getting better. The ideal duration for the patient to seek treatment from the onset symptom is 6 months.
However, surprisingly, the result from the survey that has been conducted in Malaysia shown that the current duration of the untreated psychosis is 28 months, which equal to 2 years and 4 months. Some say that schizophrenia is untreatable. Is it true? Actually, there are ways that can help people with schizophrenia. An effective treatment requires both pharmacological and psychosocial treatments. Pharmacological treatments consist of antipsychotic medicine such as haloperidol, clozapine and others. Psychosocial treatments such as counseling, family support and rehabilitation as well.
We care about you and let us help you. If there is any emergency, please do not hesitate to call 999 or 911, or you can directly contact these following numbers.